I'm Dr. Chris Kammerer, and this weekend was very important because we had the founding meeting for the American Academy for Oral Systemic Health, and it's a group whose time has come. I think with all of the exciting things that have been going on in dentistry, there's been a movement that has been where studies have come out connecting oral health to body health. And I think when I started out in dentistry, it was kind of about fixing a little tooth problem, putting a little something there, and helping people feel better, and there was nothing wrong with that. But I think I went into dentistry because I didn't really want to be involved with life and death, because that's what I thought dentistry was, a little more casual. And the longer I've been in dentistry, the more I realized that dentistry is all about life and death now, because all of the major illnesses that are killing people every year have a dental component, have a dental connection. In other words, if the oral disease that's going on in your mouth can make you more likely to die from a heart attack, more likely to die from a stroke, more likely to develop diabetes, or make your diabetes worse, or even die from diabetes. I mean, the connections just go on, and I think with my background in cosmetic dentistry, and my father, Jack Kammerer, who founded the American Academy of Cosmetic Dentistry, took me under his wing, and I saw that whole wave sweep across dentistry. And it was a giant wave, and it was an exciting wave. And for once, people were wanting to go to the dentist because we had something they wanted. Whereas before, we always seemed to be a necessary evil. They walk in feeling fine, and we tell them they have 3 cavities, and then they think, oh, I walked in feeling great, walked out thinking like, oh, dread, I've got 3 cavities, and I have to have a shot and a drill and all that. But then cosmetic dentistry occurred, and what a wonderful change it was. And it was a huge wave. It was like dentistry was embraced by the public and the mainstream, and you'd see dentists on major television shows doing wonderful things for people's smiles. And now we're learning more that what goes on in the mouth affects the rest of your body. So now there's a new message, a new wave that's starting to roll in, and it started. When I got tired of seeing unhealthy gums in my own practice, I just got fed up with it. I said, there's got to be a better way. There's got to be a way we can stop this disease. Why just accept it? When our cosmetic dentistry looks as beautiful as it does, why can't we do something with those gums? So I started learning more about gums and gum disease and ways of getting it under control. And as my interest in that area expanded, I started paying attention to the studies. I found mentors. And I got to the point where once I started locating studies and having studies sent to my email box through Google searches, study after study was coming in connecting the mouth to all the diseases that are out there, all the diseases that are killing people, like I said, heart disease and stroke, diabetes, Alzheimer's, cancer. I mean, the list just goes on, and it started to register in me that this dentistry is a life and death situation. Not what I was expecting when I started out in dentistry. And then what goes on in the hygiene department is a life and death situation. We always thought that hygienists had the gums taken care of. And some do. Many don't. Here's why I know that. The Surgeon General will tell us that 80% of the population has gum disease. Now, if that's true, that means that 80% of your practice should be getting something beyond a prophy. Yet the insurance statistics tell us that only 10% of the people are getting gum therapy, meaning something beyond a prophy. So if 90% of the people are getting a treatment that is by definition for healthy gums, and yet the Surgeon General tells us 80% of the population doesn't have healthy mouth, healthy gums, that doesn't work. Something in there that is very, very wrong. And when I got together with Ron Sheftor and we promoted a seminar, and Mike Milligan as well, we tried to get the word out about that. And I could see the next 60 Minutes show about this big problem of gum disease, and dentists aren't getting it under control. And the most common inflammatory disease of the body is gum disease. Sitting here in our hands, we haven't done enough with it. Practically, we haven't done anything with it. But that's about to change. It's life and death. It's a life and death situation. And so it's time to ring the bell. It's time to educate our colleagues. It's time to educate dentists and hygienists. It's time to work together with the medical profession. And it's also time to educate the public. because the public doesn't know. They're starting to hear more and more of this, but they don't know what we know, and we need to share it with them so that they'll be more in tune with these connections. Anyone that's being treated by a doctor to reduce their risk of heart disease, is that doctor asking them about their dental health? And because clearly the studies show that that can reduce their risk. Can reduce, good dental health can reduce your risk of stroke or dying from a stroke. But is that going on in the medical community? We need to partner up with the medical community. So my vision is a world where the dentist is as a part of the team to keep people healthy, becomes a part of the physician team, or we work together and for the best interest of the patient, and then people have the best chance of staying healthy. Now, how are we going to make that happen? We need to educate the physicians, we need to educate the dentists, we need to teach the dentists and the physicians how to work together. And we need to educate the public so they'll seek this out. That maybe it'll be somebody who's already under the care of a physician for their heart condition, and they might say, hey, I heard that your gum health is a factor in there to reduce my risk, that I need to have healthy gums. What do you think, doctor? And they're talking to their physician. Well, hopefully the physician will say, absolutely. In fact, we are working with a dentist, and today we are going to send you, there for a referral. We would like to get clearance from your dentist that you indeed do have a healthy mouth, or your gum disease is under control. Now, then we need to make sure if physicians are sending their patients to dentists, we want to make sure that those dentists are in tune with the best ways of getting that gum disease under control. And that's a whole other area of this American Academy for Oral Systemic Health. So we need people that care. We need people that understand that the best health of the public depends upon this collaboration and this great spirit of cooperation. And if you believe in that and you want to be a part of that, then the American Academy for Oral Systemic Health is the place for you to be. Because that's where our mission is to help dentists and physicians work together for the best health of their patient, to cooperate, to understand, to educate one another. We know things physicians don't know. Physicians know a lot that we don't know. So now, the time has come. Health is such an important thing. Everybody wants health. Everybody wants good health. They don't just want the Band-Aid approach to, look, I've got a disease now, let's put a patch on it, or let's cut that out. I mean, we want to bring health, and the best way to bring health is to go to the source of the disease and try to see if we can cure things. And that's what we're all about. So we really want to decrease patients' risk for health. We want to offer people the opportunity for the best possible health, and I believe that starts with oral health, and that's one of my missions, that's the first place to start. So the American Academy for Oral Systemic Health is all about that, all about educating the importance of oral health, how it's connected to other bodily diseases, how we can communicate that message to the media, to physicians, to work well in the spirit of cooperation, and bring the best information to the public as well. And it's a big thing, because it is a life and death issue. It is not you can't be casual about that. You have to be intentional. And a lot of people have been wanting to do this for a long, long time. So join us. If this is something you're passionate about, the people that are passionate about this right now have gotten together and they formed the American Academy for Oral Systemic Health. And the passion to change the world lives in that organization, and we will create change with your help. So give us a call or look us up on the website. That would be AAOSH.com. The American Academy for Oral Systemic Health exists, it is alive, it is well, it is functioning, and it needs you. So help us take the message to the people, help us create a better health model for the world.